Human papillomavirus, causes, symptoms, and treatment. Human papillomavirus, commonly referred to as HPV, is one of the most common infectious diseases in the world. It's estimated that nearly 80% of sexually active people will contract HPV at some point in their lives. HPV is a virus that affects the skin, and it's spread through direct skin-to-skin contact, such as sexual intercourse. It can cause a range of health problems, from genital warts to cervical cancer. It's important to understand the causes, symptoms, and treatment of HPV in order to protect your health. Read on to learn what you need to know about HPV, including how to recognize it, treat it, and prevent it. What is human papillomavirus, HPV? Human papillomavirus, HPV, is a group of viruses that impact the skin and mucous membranes of the mouth, throat, and genitals. There are more than 150 different types of HPV. Some types can cause warts on the skin, while other types cause genital infections. Approximately 40 of these types can cause cervical cancer, although this article focuses on HPV and its health effects. The most common symptoms of HPV are genital warts, abnormal pap smears, and abnormal vaginal bleeding during or after sex. Other important information about HPV. HPV is highly contagious, but it's not easy to transmit from one person to another. You can only get HPV if you have sex with someone who has it. The virus can also be passed if your mouth or genitals come in contact with someone else's infected skin or mucous membranes. How is HPV spread? The skin is the main way that HPV is passed. If you have HPV, and then touch your penis, vagina, or anus with your unwashed hands, you can transfer the virus to your partner. You can also get HPV by touching your mouth, nose, or eyes while handling someone who has the virus. HPV is most commonly spread during sex. But it can also be passed during vaginal, anal, or oral sex with an infected partner. It's also possible to get HPV by sharing sex toys, and by kissing or performing oral sex on an infected partner. What are the symptoms of HPV? Genital warts. A common symptom of HPV is genital warts, which are warts that can appear on the penis, vulva, cervix, anus, or scrotum. Genital warts often appear as small, flesh-colored bumps. They can be painful and cause itching, and they're often hard to remove. Genital warts are not cancer, but they can disrupt your sex life, cause embarrassment, and affect your self-esteem. If you have genital warts, you can help treat them by removing the warts completely. You can also use condoms to protect your partner from getting infected. Normal pap smears. While most pap smears don't show signs of HPV, you can get a positive pap if you have genital warts on your cervix. Genital warts are not cancer, but they can cause abnormal pap smears, which can lead to unnecessary biopsies, abnormal pap tests, and treatment. You can protect yourself from abnormal pap tests by protecting your cervix with a condom. How can HPV be diagnosed? Most cases of HPV are often not diagnosed. You can have signs and symptoms of HPV, but your doctor may not notice them if you have other health problems. HPV can be detected by a pap test, which is the most common way to test for the virus. A pap test uses a sample of your cervical cells to look for signs of HPV. If you have HPV, your pap test will show signs of cell damage, and this sample can be used to determine if you have HPV. It's important to understand that pap tests only detect HPV if you have the virus. There are also other blood tests and other types of tests that can detect the virus. What are the possible complications of HPV? Cancer. If you have HPV and don't protect yourself from infection, you have a high risk of getting cervical cancer. Genital warts. If you have genital warts, you're at a higher risk of getting an STD, such as chlamydia, syphilis, or HIV. Human immunodeficiency virus. If you have HPV and don't protect yourself from infection, you have a high risk of developing HIV. HIV is a virus that weakens your immune system, which can make you more likely to get diseases, like cancer and genital warts. Genital birth defects. While the vast majority of babies are born without birth defects, your chances of having a birth defect increase if you have HPV. Triggered skin rashes and warts. If you have HPV and don't protect yourself from infection, you're at a higher risk of having triggered skin rashes and warts. How is HPV treated? There is no cure for HPV, but there are treatments that can help relieve the symptoms. HPV treatment depends on your symptoms and the type of HPV you have. If you have genital warts, you can use medicated creams, gels, or suppositories to heal them. If you have anal or cervical warts, you need to have them removed by a doctor. If you have cancer caused by HPV, there's currently no cure. The treatment is usually to treat the cancer, followed by chemotherapy to prevent any chance of developing HPV cancer. How can HPV be prevented? There are several ways to protect yourself from HPV, including using a condom every time you have sex. Condoms can protect you from STDs, but they also protect against HPV by covering your genital area. Not sharing sex toys. If you don't want to share your toys with an infected partner, consider buying new ones or using a new toy for each partner. Not sharing smoking pipes, cigars, or joints. Sharing pipes, cigars, or joints exposes you to HPV, just like sharing sex toys. Using dental dams. If you have oral sex with an infected partner, use a dental dam to protect your mouth. Using antiviral medications. There are medications that can clear HPV from the body, making it less likely to infect others and cause health problems. HPV vaccines. There are currently 2 HPV vaccines available, and they can help protect you and your partners against HPV-related health problems. The vaccines prevent infection with the 2 types of HPV most commonly associated with health problems. Gardasil. Gardasil protects against 2 types of HPV that are most likely to cause cancer, and it's the only vaccine that's been proven to prevent cancer in people who have already been infected. Cervarix. Cervarix protects against 2 types of HPV that cause cervical cancer. HPV testing. If your Pap test shows signs of abnormal cell changes caused by HPV, it doesn't mean that you have HPV. It means that you may have a higher risk of having HPV and could benefit from testing and treatment. There are currently 2 types of HPV tests: polymerase chain reaction (PCR) tests and liquid-based cytology (LBC) tests. PCR tests are more accurate, but they can only be used once you've been diagnosed with HPV. LBC tests can be used at any point during your menstrual cycle, but they are less accurate than PCR tests. Summary. Human papillomavirus, HPV, is a common virus that can cause genital warts, abnormal pap smears, and abnormal vaginal bleeding during or after sex. There is no cure for HPV, but there are treatments that can help with the symptoms. There are 2 types of vaccines available, and they can help protect you against HPV-related health problems. Human papillomavirus, HPV, is a common virus that can cause genital warts, abnormal pap smears, and abnormal vaginal bleeding during or after sex. There is no cure for HPV, but there are treatments that can help with the symptoms. There are 2 types of vaccines available, and they can help protect you against HPV-related health problems.